I extend a warm and cordial welcome to the HOD of English Department, Father Joshi Matthew, Dr. Loyola Thomas and Professor Jerin Jose, PG and UG coordinators of the department, faculty members, participants, and my dear students. Our first plenary session for the day is titled Art of Visualization to Understand the Complexities of Health System, Amalgamation of Health and Humanities. Through the lens of health and humanities, we seek to unravel the artistic dimensions that contribute to a more comprehensive understanding of healthcare structures. To enlighten us more, we have with us our distinguished resource person for the session, Dr. Piyusha Majumdar. She has a PhD and Masters in Anthropology from the Department of Anthropology, University of Delhi. She is an alumnus of Miranda House College, working as an associate professor at SDG School of Public Health, IIHMR University, Jaipur. She is a public health specialist and implementation researcher who has participated in a multi-country research project titled Synthesis and Translation of Research and Innovation in Polio Eradication. She is a faculty member listed in IR Connect platform supported by TDR. She is also a recipient of This is Public Health Grant. She has been instrumental in designing high-quality project proposals for national and international clients and has brilliantly implemented multi-research projects in the area of implementation research, public health, child health and nutrition, maternal and child health, HIV/AIDS, tobacco control and health communication. Some of the prestigious international projects were awarded by UNICEF, World Lung Foundation, Institute of Health Metrics and Evaluation, USA, and International Union Against TB and Lung Diseases. As a faculty at IIHMR, she has been vigorously involved in guiding, mentoring, and teaching MBA students. She has a plethora of publications for national and international journals. She is also an editorial board member for Academic Journal of Anthropological Studies and review editor for the Frontiers in Tropical Diseases, Health Policy and Planning and Asia-Pacific Journal for Health Management. Welcome, Dr. Piyusha Majumdar. Over to you, ma'am.
Thank you so much. Thank you so much for this introduction, and I hope my screen is visible. So before starting this plenary session, I would like to thank the organizers for inviting me in this international conference on health and humanities, and I am really amazed to see the audience who's sitting there. So thank you so much. And I'm a strong believer. That we would always need a humanistic approach when we wanted to deal with a healthcare illness or implementation of any healthcare program. So is it moving? My slide is moving. Can someone please confirm my slide is moving?
Hello, ma'am. It's on the first page, which has the title Art of Visualization to Understand the Complexity of Health
Okay,
Systems.
but I am, okay, just a sec. I'm not been able to go to the next slide.
Can you exit the projection mode, ma'am, and try?
Yeah. Is it moving?
Yeah, we have the first slide, Health Humanities, the title slide.
Yeah. Okay. Thank you so much. As I said, that I'm a strong believer that we always need a humanistic approach to deal with healthcare illness and the implementation of healthcare program. So what is health? When we talk about health, it's a state in which there's a complete physical, mental, and social well-being. So we're concerned with that, and not merely the absence of the diseases or infirmity. And as in this presentation, I'll be talking more about the health systems. So when we talk about the health systems, it's comprised of many organizations, the people and their actions, and all these people work together to basically promote and restore the health. So in this presentation of mine, I'll be talking about how we can use visualization as a tool. Yeah. So in this presentation, I'm going to use how we can use visualization as a tool to, understand the complexity of health systems. Is it moving? Yeah. Okay. So in this presentation, I have two major objectives. I'm going to focus on two major objectives. First major objective is the rationale. We need to understand the rationale of using system thinking. I'm going to talk about how we can use system thinking for public health. And also we're going to explore the art of visualization and how we can use visualization as a tool to understand the health system. So I wanted to start my presentation by giving a very prominent example of Ebola. So Ebola, there was an Ebola outbreak in Sierra Leone, and I'm using this example to to give you to explain you how disease and culture are related. So this Ebola disease, it was first identified in DRC, Democratic Republic of Congo, in 1976. And when there is an outbreak, we all know that what we do. So when there is any outbreak, what medical fraternity do? They focus majorly on the disease. They focus majorly on the surveillance. They focus majorly on the the various measures or its treatment. So what has happened in Sierra Leone when this Ebola outbreak was happened? The epidemiological analysis, it shows that the virus was spreading, and despite all the vaccine government measures, it was it was spreading like anything, and people were dying with the disease. But then so there were like researcher, there were like medical fraternity, everybody was very concerned, what is the cause of the disease? And then and there was an anthropological research that has been carried out, and it was found that the disease was spreading basically because of the cultural practices that have been used by the people with the with those people who have died. So the cultural practices of physical contacting, like washing, rubbing, touching the people who are sick or dead, they were the main factors on its for its spread. So now and this has led to various infection, and there was very less awareness on the people that how this virus was spreading. So by giving this example, I want to say that health is a holistic concept. So it's not only the one factor that cause a disease, but there are several other factors. It's a holistic concept, and the complexity can be seen in various social and cultural practices also. So what they did, they transformed, or the funeral rite, and a new funeral rite was explored, in which they a forgiveness was sought from the deceased, and they have not used this cultural practice, and by using this, the Ebola virus disease, it can be controlled. So by using this example, I wanted to say that it's not only, the medical fraternity, but several other people and skills were used to control a disease. Now, as you can see in this slide, there's a public, so it's a slide that shows that public health system. It's a very complex and adaptive system. As you can see in this figure, an individual's health depend on the multiple factor. And that is why we require a system thinking approach to understand, our system. So, in other words, like we can say that it is a complex adaptive system. It's a complex system which is always adaptive, and it depend on the society, social determinant of health, and individual's health also depend on the environment in which the person is living. It also depend on the biological determinants. And then there are personally acquired potential and the demands of life. And as you can see in this arrow, these all are interconnected. So the interaction and the relationship between these components, they affect and they shape a system. So by looking at this slide, I can say that, so we need to understand a system thinking approach if we wanted to understand a public health system. So we need to understand what are the environmental factor that is acting on an individual's health, whether there is any social determinant, the age, demography, whether there is any cultural factor, whether there is any technological factor, whether genetics. So that is why if we wanted to determine health of an individual, we take into action all those factor, and we need a system thinking approach to understand this system. Now let's understand what system thinking is all about. So system thinking, basically, it's a discipline where we look forward for the patterns, we look forward for the interrelationship between each component. We wanted to see how these relationship, they affect. We wanted to see the cause and effect of that. So and this system thinking, we can use this system thinking approach to solve complex problems, which is associated with public health, by understanding their relationship, by understanding their interconnectedness, and also the boundaries. So it's a very important approach. And as I said that there are three main key aspects of system thinking. We need to understand the interrelationship. We need to understand the different perspective of the people. We need to, establish boundaries. So we have to understand and analyze this complex system by looking at the whole system rather than focusing only on one thing. So basically, when we talk about the system thinking, it helps in understanding what depends on what. What kind, as I shared this example that the main reason for spreading Ebola virus is very, very different. It depends on the cultural factor. So what depend on what is causing what disease is caused by which activity. Where does the information flow? So whenever there is a public health system, we also deal with the human resources. So where does this information flow? And the stakeholders, how we can engage the stakeholders to solve our critical problem. Where are the leverage point? How we can intervene in the system to get the result? Where we can, intervene? So this is basically, this figure shows that system thinking is it's like an elephant, and there are, as you can see, there are 7 different people, and they're blind people, and they are describing this elephant by taking their own perspective. So somebody is saying it's a faded leaf, somebody is thinking that's a high mountain, somebody is thinking that this is a branch, somebody is thinking that this is a tree, somebody is thinking that this is a cave, and somebody is thinking that this is a snake. So this is like, lack of understanding, because they are not looking at the holistic, the whole perspective. So lack of system thinking is basically, it's like 5, they're blind people who are explaining an elephant from their own perspective. And as a result of this, the 6 blind man they're describing, and as a result of this, there are unintended consequences. So when there is a lack of a system perspective, then it can lead to unintended consequences, as you can see that, and this unintended consequences, they can lead to the bigger problems later on in the system. So that is why, the practitioners or the system thinking, it helped the practitioners, those who are practicing it in the health system. So they help to understand the perspective. So these practitioners need to see differently, they need to think differently, they need to act differently by looking at the wholeness of the system. How we can see differently? So health system help the practitioner to see differently, to understand what is the perspective of the patient. It can be seen differently by looking at the perspective of the patient, by looking at the health system building block, and more importantly, by focusing on the health outcome. Now, how we can think differently? We can think differently, or the practitioners can think differently by using the process of inquiry, by using the approach of synthesis, or by analyzing. Now, how can we do this inquiry? How can we synthesize and how can we analyze? So we can do all these things by using system thinking tool that I'm going to talk about in my next slide. And these system thinking tool require visualization. And that is how, our visualization and system thinking tools are interconnected. So as I said, that system thinking, it requires some visualization tools, and these visualization tools are the first one. There are various visualization tools that are used in system thinking, and for public health domain. But here I wanted to focus majorly on rich picture, IRD, which is interrelationship diagram, and causal loop diagram, or CLD. So by using all these three, we can find out the complexity, and we will be able to find out the solution, which is caused by looking into the complex system. So what rich picture is? What is this rich picture? So rich picture is basically, it's a tool, it's a visualization tool which we are using to define a situation. So whenever there is a public health issue, there might be several reasons that are causing that. So rather than focusing on one problem, we need to see the holistic situation of that problem, and this can be drawn by using diagrams. And this diagram basically create a mental model, and it can also take the perspective of different people. And when different people come together to make a rich picture, we can get a broad understanding of the situation. Now, what rich picture helps us? So rich picture is basically, they help us in defining the boundaries of the system. What are the boundaries of the system? If what is my healthcare provider's responsibility? How far is my public, health center is from the place? They help us to identify the various elements or variable in the system. What are these variables? So my variable can be, some environmental factors that is responsible for that. My variable can be some other social determinant can be responsible for that. And how we can change, and these variables, they might change over time. So if we wanted to, make a solution of a complex problem in a public health, we need to work on system thinking. We need to do a system thinking, and this one of the tool of the system thinking is the rich picture. So if we wanted to do all of these, we need to prepare a rich picture of that. So that is a rich picture looks like. And as you can see, the problem here is homelessness. So for this homelessness, there are several, there are several factors, there are several elements which is responsible for that. So if a person is homeless, he really wanted to have something to stay in. He wanted, there are NGOs who wanted to assess that what are the services which is eligible for this person, where he can get the medical services or the treatment, where he can get this shelter. And if the person is homeless, obviously he doesn't have the money. So the police and the other people need to see whether they're breaking the law or not. So this is a kind of a rich picture in which a person need to look at, we need to look at this problem from the all the dimensions. And as you can see in this arrow, so these arrows are basically showing the interconnectedness between one variable to another variable. So as I shared earlier, that rich picture is basically the situation analysis, and it is mainly developed to gather information about a complex situation. We prepare a rich picture at the pre-analysis phase. When for any public health problem, when we wanted to implement any program, any government program or any health related program, we need to find out, we need to do a situation analysis, and this situation analysis can be done by using this rich picture. So as I said, that it is this rich picture is drawn at a pre-analysis stage so that we understand what is the situation. And basically, this is also a process. So it helps us in giving the exact picture of a complicated situation. And it's a very, it's a diagram and which representing a cartoon representation of all the ideas from the holistic perspective. Later in the slide, I'll also be showing the actual, preparing of this rich picture and rich picture IRD and CLD during my class. So why we are using rich picture, as I said earlier, that the tacit knowledge is incomplete when it comes to the inquiry or when it comes to the synthesis. And if we need more explicit data, so we use a rich picture. We wanted to understand in any system, we wanted to understand the relationship, how, what is the relationship between each stakeholders. So for that, we need to make a rich picture. Rich picture helps us in getting a multiple perspective. And all the more as you've seen in the diagram, it helps us in capturing the complexity. So what is the complexity of the situation? And also it helps us in identifying the boundaries of the system. Now, I have already given you an example. What are the elements of this rich picture? So the elements of this rich pictures are, we can use the symbols, we can use a pictorial symbol, we can use the keyboards, we can use the cartoons, we can use the sketches, we can use the symbol, you can use the title. So this is somewhat, this is a case study of Uganda's, neonatal death. So this is a case study for Uganda's neonatal death, and the team has developed a rich picture for that. That what are the reasons, what are the factors that is responsible for a neonatal survival? And as there are interconnectedness, so a quality of life of a neonate depend on attitude of the health service provider. It also depend how far is the health facility. It also depend the medical supplies. It also depend how health staff are motivated to get the they are motivated to give the services. It also depend how many population we have. It also depend what is the distance of health facility. It also depends the mother's knowledge. It also depends, mother's perception of a health system, whether she is going to get the services from the health facility or not. It also depends, there are various factors, as I said earlier. There are personal and household factor, there are community factors, there are allocation of resources. So that gives us a complete picture. So in Uganda, how the allocation of resource takes place from Ministry of Health. Then there are several international factors also. There are several community factors also. What are the, communities leadership? How are the, they are influenced by the peer or community. Then there are certain cultural, religious factor also, spouse's decision-making power also. So this is the entire picture where we have taken into consideration all the important factor, whether it's household factor, whether it's health system related factor, whether it's community related factor, whether it's any other environmental factors, which affect a neonatal's survival. So this is how we draw a rich picture. Now, this rich picture, once this rich picture is drawn, it forms a basis of IRD, which is our interrelationship diagram. So interrelationship diagram, it is also a visual tool. And as I said that it is built on rich picture. So once this rich picture is drawn, we need to find out a cause and effect. We need to determine what are the drivers and outcome. So as I said that this IRD, it's a visual tool and it is also a planning tool that helps us in finding the relationship, between the two variables. And it also helps us in finding the cause and effect relationship. Now, when to use this IRD? We use this IRD once our rich picture is ready. We use this IRD when we wanted to implement any complex strategy. And it can be used, by using a fishbone or a tree diagram and how different problems are being interconnected. So this is our IRD or interrelationship diagram. So in this diagram, as you can, so this diagram is prepared from the rich picture that we have shown earlier. And as you can see, these arrow, so they are basically determining the outcome. What is the outcome? If this happened, then what is the outcome of that? And what are the drivers and outcome of particular element. For example, health of the mother is also dependent on socioeconomic status. Similarly, socioeconomic status is also dependent on the death risk of a neonate. When the health of the mother, it also depend whether she has gone for the safe delivery or the postnatal care. Health of the and newborn care is also depend on the health of the mother. What is the level of awareness of maternal health and neonatal health? Whether mothers are attending ANC hospital deliveries and PHC, what are their perception and belief? What are the health education by health workers? Whether mother is prepared for the birth or not, and how a neonatal. So a neonatal survival depend on multiple things, and once we get the rich picture ready, we can prepare this IRD, which is interrelationship diagram. So why we are making this interrelationship diagram, which is again a visualization tool. This interrelationship diagram helps us in in considering what are the interaction that is going on between the variables, and we make a mental model of that. That okay, this is not the main reason. There are several other reasons. There are several other factors that is responsible for that. What is the outcome? As I said earlier, that IRG or interrelationship diagram help us in identifying the outcome or the driver in a complex system. And finally, once our interrelationship diagram is ready, we can form the next, it will help in information of the next visualization tool, which is CLD, causal loop diagram. So, and this causal loop diagram is important so that we can, identify our feedback loop. So this CLD or causal loop diagram, they helps us understanding what are the actions or what are the mechanisms that drive the behavior in a system. What is the feedback? Feedback is basically the cause and effect loop which we wanted to see, or cycle of behavior that is emerging through this diagram. So this is a causal loop diagram somewhat looks like. So we have positives, as you can see here, we have positive and negative. So this feedback loop helps us in understanding where are the leverage points. It helps us in understanding what is the system structure, which component give rise to a particular behavior. And as I said, that system thinking helps us in understanding the unintended consequences of an event. So this unintended consequences can be controlled by preparing the CLD or causal loop diagram. And it also helps us, in exploring the relationship and the delays that are causing. So before preparing a CLD or the seed structure, we need to look at the interrelationship diagram. We need to identify what is our outcome or what is our output or outcome variable, which is the variable of our interest. For example, my neonatal survival is my outcome of interest. Then what is causing what? And also the intervention, as I said, that the intervention which we are, which is helpful or driving that my CLD seed structure. So this is how we can build a CLD drawing by identifying a seed structure. So the in this diagram, as you can see, the orange colored things, the orange colored variables that I have written here, these are basically our seed structure. So death risk of neonate, safe deliveries and PNC, mothers attending ANC hospital deliveries and postnatal care, and the level of awareness of maternal health and neonatal health centers. So these are basically our seed structures, and we have formed a feedback loop. So the feedback loop can be formed that this leads to increase in that and this leads to decrease in that. So this is kind of a feedback loop that as you're looking at that level of awareness of MHC and NHC, there are two feedback loop. One is going towards the perception of belief and myth. Another one is going towards level of it's a downward. So both these things, they depend on the perception of belief and myth. So the level of awareness, so this is our leverage point. And this leverage point is when we work on it, or in our intervention work on the perception or belief or myths or cultural factor, we can help in increasing the level of awareness for maternal health and for neonatal health. So that is our leverage point where we can work upon our interventions. So basically, in our slides, I have talked about three major visualization tools. The first one is the rich picture. Second one is the IRD or interrelationship diagram. And third one is causal loop diagram. Now, this is our one of our students. So when I teach system thinking to students, so we use some case studies and then try to build a rich picture out of it, and then prepare how can we, what are the interrelationship between these variables and the CLD, and how we can solve these complex problems. So this is one of the tasks which was done by my students here. So this rich picture is drawn by the students who have, so they have prepared a situation analysis of the reproductive maternal and child health in Yemen and how they are affected. So they have prepared in this picture, they have prepared that what are the major problems the women are facing at every level. Who are the funders here? For example, here they have written WHO, UNICEF, and NGO. So, they are the donors here. But what is the problem here? There is no access. So women cannot, go to, so they have no access to it. Then they have also tried to find out some of the social determinants, some of the cultural determinants, religious determinants, the education level, what are the behavior and what are the gender role there, and the economic situation, and how it can affect the immunization coverage, how it can affect the malnutrition, how it can affect the mortality, and how it can affect the pregnancy complication. When it comes to the health system, there is a shortage of health workers. There is no incentivization. There are problem at logistic and supply chain. There are problematic equipments. The community health workers, they're very poor infrastructure. There are, the conflict situation is going on. So that is why, what are the political barrier and how communication and reporting affect the RMNCHA in Yemen. And this is how they have tried to prepare an IRD interrelationship diagram. That how they have, what is the interrelationship between them? What are the boundaries? And this is how they have prepared a causal loop diagram and try to find out what kind of a strategy we can use or how we can work on the interventions. Now, as time is running fast, so this would be my last slide. As in this presentation, I have talked about all the the visualization tool that can be used to understand the system. But how we can actually use this system thinking tools or this visualization tool. So we use all these system thinking tool when we wanted to explain a root cause of a problem, when we wanted to find out the problem of any the health related problems or the implementation of any problem. We wanted to find out the challenges. What are the challenges? Why we have not been able to implement our programs. So this kind of a system thinking tool helps in finding out the root cause of the problem, and it also helps in finding out the drivers of the drivers of the implementation or the facilitator of the implementation. This system thinking tool is also used for a feedback mechanism. If we have implemented anything and we wanted to use a feedback mechanism, this system thinking tool can be used. The second point is we can use this system thinking tool to identify the leverage point. As I have shown you in the diagram that there are two things which is interconnected. So how we can use this leverage point for doing any intervention. Third one is this system thinking tool. It helps us in exploring what is our what would be our outcome and or how can we measure our outcome? What are the different variables and how can we measure the outcome? We can use all these visualization tool if we wanted to model the impact of systems intervention in our health system. We have many interventions which is taking place. So when we wanted to model it, we can use the system thinking or the visualization tool. When we want to work at the policy level or the policy resistance, this system thinking can be used. So for any health policy level, a lot of people are working on using the system thinking tools. This system thinking tool, lastly, it also helps in formulating the research question. Like if somebody wanted to do a research, so this tool can help in formulating the research questions. That where are the problem, and so that is why this is used. And as I am an implementation scientist, we always believe in a theory of change or how can we change the system. So this system thinking tool helps us in preparing a large picture of theory of change. How can we change it? So the system thinking tool helps in making or building a theory of change by looking at all the possible assumptions, by looking at all the indicators, by looking at all the interventions that are taking place. So this would be my last slide. So as I said that, the system thinking, which I talked here, and the visualization tools. So for any system thinking, it requires a multidisciplinary skills. It requires people from different background. It requires people from both the health and humanities. So not only medical fraternity, but the anthropologists, sociologists, the people who study HR, the people who study organization behavior, so it requires all those expertise to understand system thinking. And that is how we can do an amalgamation of both health and humanities here. Thank you so much. And you can connect me on piyusha@ihmr.edu.in.
Okay for you, ma'am? Anyone has any questions? Ma'am, we do have one question.
Good morning, ma'am. Thank you for that presentation, and that was indeed a new idea. Even if we know this is how the whole system works, and this is important in implementing heavy tasks. And I feel it's more like what say the technical side of implementing things, implementing newer measures. That's what I understood from all your perspectives. But being a research scholar in health humanities, we try to integrate art and literature as a part of as an interdisciplinary perspective in our research, in approaching medicine and treatment, human health, everything. So you have just concluded by telling that this kind of a measure can be utilized for research as well. So it's just my concern to know how we just like a case study. Can you just explain in short words how can we integrate arts and humanities and such a research layout can we utilize in this kind of system thinking technique? If you have any kind of small idea, taking this as a specimen work, how to integrate arts and humanities subjects in a research, and how can we prepare all these rich pictures and such kind of diagrammatic techniques, if you can, if you do you have any kind of opinion idea regarding this?
Okay.
Okay,
Thank you
thank you
so
so,
much
so
for
much
this
for
question. I'm getting a lot of echo. Yeah. So, very, very valid and pertinent question that you have asked. So, I'm an implementation scientist, and in our implementation research, we say that we require, as you said, that in research. So so in implementation research, which even government is focusing, so they are saying that in implementation research, it's not only one person who can solve the problem, and we require the skill and expertise of all those people. We require the as you know, arts and the visualization techniques are being used, so we require the skill of all those people who are not from the medical background. So any anthropologist, as I said, that the humanities or the sociologist can just come and solve this problem or do the research. So implementation research is a field, and implementation science is a field where you can work, or where you can do your research. I hope I have answered your question. And in case you want more details on what implementation research is all about, or what implementation science is all about, you can connect with us, because I have started this course on Masters in Public Health and Implementation Science with support from WHO TDR, and TDR are focusing a lot on they're focusing a lot on the disease of poverty. For example, malaria is there. So and they wanted to do the implementation research, that what exactly is the cause of these diseases in low and middle income countries.
Thank you, ma'am. There is another question from one of our participants who has joined online. The question is there any solution to maintain adolescent health in dysfunctional families?
the solution to handle the adolescents, I think the question lies with the parents, the society, the community. We really need to educate them, and not only education, but also we need to reinforce the thing that our culture is most important. When we talk about the Indian culture, few days back we did this the Ayodhya, in Ayodhya temple we did that Pran Pratishtha of Bhagwan Sri Ram. So we need to reinforce the culture to the adolescents. We need to tell the students, the adolescents, and it is the great responsibility of the teachers in doing so.
Thank you, ma'am. Now I invite Ms. Preeti to deliver the vote of thanks.
Good morning, all. On behalf of the Department of English, I would like to extend my heartfelt gratitude to Dr. Piyushi Majumdar. Ma'am, we deeply appreciate the insightful and engaging session. The talk highlighted the cultural, social, and biological factors that contribute to the perception of the medical system. Your valuable talk on the unintended consequences within the system of medical studies defines our understanding and scope of the field of study. Your talk has broadened our understanding of the complexities and dynamic nature of our health system. Ma'am, we're truly honored to have had the opportunity to host you at Kristu Jayanti College. Thank you.
Thank you so much.
Thank you so much for inviting. Take this moment to thank Father Joshi Matthew, Head, Department of English, for his constant support and encouragement in all our various literary endeavors. I extend our gratitude to Dr. Loyola Thomas and Mr. Jaren Jose, UG and PG coordinators, respectively, for their constant assistance and insights that help the department grow. Thank you, ma'am and sir. I also thank the audience for their active participation and for their engaging, lively discussion on the session. Thank you all. Kindly note that we will have a short break for 10 minutes, but students are expected to remain seated here. The participants, please note that tea and snacks are served at the pantry. The volunteers will help you. Students, please kindly note you are expected to be seated here. Thank you.
Kristu Jayanti College and was glad to know that it is managed by CMI fathers, which is making a significant impact in the field of education in the nation.
In the hallowed halls of Kristu Jayanti College, a symphony of transformation unfolds, where the echoes of knowledge, skills, values and attitude resound as the very heartbeat of our educational edifice. Here, we do not merely in the hallowed halls of Kristu Jayanti College, destiny, a symphony of aspiration and instill values, where the echoes of not just career skills, but the very essence and attitude of humanity resound with the students' heartbeat of our education. Astonishing 12,000. Here, we have grown in the hallowed halls of Kristu Jayanti College. Students are only the 20 aspirations and instill values, where the echoes of not just come together, but the very essence and attitude of humanity and ambition. As the very heartbeat, we are on foundation with our expansive career of 12,585 undergraduate students and postgraduate aspirations designed in institutes of ideals of not just passion together, but the very essence and attitude of humanity and ambition. As the very heartbeat, we are on foundation with our expansive career of 12,585 undergraduate and with strategic ideas of 3.7 during the first cycle of accreditation. We are on foundation with our expansive career of strategic ideas of with strategic ideas of 3.7 during the first cycle of our collective vision and his dedication and unfailing vision. Our expansive career of strategic against the ritual of with the strategic ideas of 3.7 it is a day that all our collective vision and his dedication. Carmelites of Mary Immaculate is an embodiment of the dream and vision of Saint Kuriakose Elias Chavra, a 19th century educationist and social reformer. Strengthened by a rich educational heritage, the CMI legacy and charism are the cornerstones upon which Kristu Jayanti College is built. The ingenuity of best practices and systems in education
Students, please settle down. We'll be starting shortly. After the session, we have the paper presentation session, which will start from 11:30, go on till 1 p.m. I request you all to kindly be seated. A pleasant morning to all. Every beginning is a subject to an end, and every end a pathway to yet another beginning. On this note, as we arrive to the last day and the last plenary session of our two-day international conference on health and humanities, exploring uncharted terrains in literary paradigm, I, Dr. Smriti, from the Department of English, on behalf of my entire team, Kristu Jayanti College Autonomous, Bengaluru, welcome each one of you present here to this plenary session entitled Constructions of Gender and Mental Health, a Critique by Dr. Dipali Malaya. From acknowledging the role and practice of empathy building in healthcare, or having a sneak peek into the discourse of narrative medicine, or community healing, to the articulation of humanistic competencies within the fields of medicine and healthcare, this conference, with a unique amalgamation of health and humanities, has already embarked us into a multifaceted, enlightening journey of diverse perspectives and enriching academic and experiential plethora. Carrying that same enthusiasm to yet another session, I find this my privilege and a matter of great pride to welcome our guest of honor, our resource person for today, Dr. Dipali Malaya. Dr. Malaya is a researcher, academician, and content writer. Research and academic teachings are her enduring passion. Along with research writing, she has also explored other professional domains such as technical writing, creating content for digital and print medium. She has authored many research papers that are indexed in Scopus and Web of Science. Her areas of research include gender, cultural studies, and health humanities. A very warm welcome to you, ma'am. I would now like to extend my cordial welcome to all my co-workers, my faculty members, the conference conveners, and my fellow Jayantians. Welcome to all of you. I now request Dr. Loyola Thomas, PG Coordinator, Department of English, to kindly present a sampling to our resource person as a token of welcome. Thank you so much, ma'am. I would now like to hand over the session to Dr. Malaya. Ma'am, over to you, ma'am.
Okay, good morning, everyone. Firstly, thank you so much for, considering me for this talk. My research has largely, over the years, dealt with constructions of mental health, specifically in the context of women, right? And today, a piece of my work would also be presented here as a part of, this talk. And constructions of gender and mental health, a critique, would be the focus of the discussion today. And while we talk about mental health, right, and when we go about understanding or categorizing or labeling or diagnosing any form of mental issue or mental disorder, we always look up to the Bibles, rather, Diagnostic and Statistical Manual of Mental Disorders, which is put out by the American Psychiatric Association, and then there is the ICD-11. And these two Bibles are, time and again updated every now and then, right? And while we look at the idea of mental disorder, just to quickly go through the trajectory, right? The Greco-Roman times to the current times, if we look at the trajectory, what started off with a scientific basis with Hippocrates looking at blood, phlegm, and the different kinds of biles, right, to understand mental illness in individuals, further went on to taking up a very, labeling mental illness as a response to the demonological force that is there within us. And then further, when Freud and Charcot and so many other neurologists and psychiatrists went about understanding mental illness, again it went back to looking at it from a scientific perspective, right? So mental disorder per se, if the DSM has to define it, is a clinically significant disturbance in an individual's cognition, emotional regulation, or behavior that reflects a certain dysfunction in the psychological, biological, or developmental processes, right, of an individual. So now when we look at, mental disorder per se, yes, you talk about a certain dysfunction which is psychological, biological, and behavioral, right? Now, and if you want to look at it from a sociological standpoint, what marks a certain disorder, right, as a disorder, is something that is opposed to the norm, right, or something that is away from the order. And if you do not conform to certain things, is when there is a non-conformity. If you do not adjust to certain, things that are happening around you, is, a maladjustment. If you are not within the, boundaries of order that is determined by, the certain, the society that you live in, is what probably categorizes you or labels you in the context or in the purview of being disordered, right? Now, it's around this, idea that I would be looking at the construct of mental illness or mental health in women, right? And to look at this, I will draw parallel interpretations with, I just thought that I'll take up a visual medium to draw certain parallel interpretations. How many of you all have watched this movie, Three of Us? Okay, very few. Now, this is one of the recent movies that I watched. I particularly liked it for, it has one of my favorite actors, Shefali Shah. Also, the kind of treatment to the movie, right? The woman, to give you the gist of it, the protagonist of this particular movie is Shefali Shah. She is a working woman married to a man, and she is diagnosed of dementia, a neurocognitive disorder, right? And in the entire movie, it is her, I mean, how she understands, or her struggles, or rather her how she traverses through the idea of accepting her dementia, accepting the disorder that is there within her, right? And living with it. Right, so that is probably how I saw this particular movie as. Of course, it's open for multiple interpretations, right? And in this process, she goes back to her, and it's dementia. It's about forgetting things, right? You do not remember, probably your memory fails to stand by you or be with you over a period of time, and it starts getting worse. And along with that, there'll be certain other behavioral responses as well to this particular disorder, right? And in this entire movie, she tells to her husband that she wants to go back and visit her, one particular hometown, her town where she grew up, most of her childhood that she said she grew up in. It's a sleepy town in the Konkan coast. And this is where she meets her romantic interest. This is where some past is, stuck, or she has rather not come, come to accept a certain portion of the past that had happened in her life, right? And this is also the place where she gets to meet her, other people with whom she's had a certain attachment to in the last, over the last so many decades. Now, the movie begins with, one of the first scenes is wherein she cooks. She's already diagnosed with a dementia. She cooks. She gets the breakfast on the table. The man is sitting at the table, and that is her husband. And there is no salt in the food, right? She's forgotten to add salt. And he says, "Can I have salt?" Right? "Can I have some salt to the food?" Now, there are two responses to this. I mean, I would like to draw even when I'm taking up this particular, movie as for drawing parallel interpretations, I would just think of what would have been a better response, right? A better response could have been not talking about it, because there's somebody who's, already trying to understand and accept what he or she, what she's going through, right? And how to accept this idea of her memory failing her, right? And there can be two ways of responding to this. Either, call it out to the person and say that, okay, can you add some salt in this? Or I just get up and, get the salt back from the kitchen and just add it and not make a fuss, right? Now, why do I talk about not make a fuss? Okay, so let's get down to understanding our mothers, okay? So do you think how many of y'all do like your mom's cooking and do appreciate your mom's cooking every now and then? You do? How many times have we heard our fathers appreciating our mom's cooking? Yeah, well, things are changing, but the number of hands that went up for, the first one compared to the number of hands that went up for now is really, probably, I do not want to, go about generalizing things. There are differences. There are, spaces which are not, there are people who are, following a certain norm or, those boundaries. They are within those boundaries that are set up by the society. And there are those who have ventured out of it, right? Now, I would like to give a disclaimer here that there's no, hard and fast, conclusions that I have drawn out of this. But, in terms of looking at it over and above, the way a woman responds to probably, another person, right? So it all boils down to the way our ego is. Now, if you look at, why do I say this? With regard to, can I have some salt? Nancy Shodorov, the feminist psychoanalyst, talks about, how female ego is not the same as the male ego. So you cannot really draw a psychoanalytical, psychosexual stages of development the same way as that of how you charter for the man, how you chart it for the man, right? So that's the idea that feminist psychoanalysts finally, not finally, there's a lot of scope further for this particular research as well. But the way a male ego and the female ego is drawn are two different, cannot be drawn on the same lines, and they are two different things. So for a woman, when you say that, when you appreciate the cooking, or when you rather, it's the ego is really relational. I would, that's the idea that Shodrov and many other feminist psychoanalysts talk about, right? For a man, it's a very stable, rigid boundary that he lives by. Whereas for a woman, the ego is determined by everyone around her. And that's the reason why it becomes constantly fluid, constantly contextual, constantly very, relational. So if this woman who's already undergoing a certain, failing in the memory, right, a certain cognitive condition, the behavioral symptoms that are attached to that could definitely be reduced if the response from the society would be slightly different, right? If the man just gets up and not makes a fuss about the salt that is not there in the food and, just adds the salt, she wouldn't probably, her ego probably wouldn't feel so bad about, oh, I took care of this, or I took up this duty, I took up this task of taking care of my husband by cooking this breakfast for him, and, okay, it went well, right? If she didn't know about the salt not being there, it would probably go well. But if you point it out that, okay, there's no salt, she's already trying to accept the idea of, how would she go through her dementia? What if she keeps forgetting things? What if she keeps forgetting people? So do we need to add on to one more, aspect to it, right? Now, going ahead, hysteria is the point where mental illness, was discussed very exhaustively by Freud and other psychoanalysts. Especially Freud, when he starts talking, when most of his work has been drawn around hysteria, ego, superego, and the whole idea of how the psyche is with the ice, like an iceberg, with the ego being the tip of the iceberg and the id, which is our pleasure principles, being submerged deep within, right? And the idea of socially acceptable and socially unacceptable behavior. Now, hysteria, the definition that, more than the definition, the way it was described over the centuries, Jane Ussher, another feminist critic, talks about how hysteria was described. Somebody who's difficult, narcissistic, impressionable, suggestible, egocentric, idle, self-indulgent, deceitful woman, craving for sympathy, privacy, and independence, and was personally and morally repulsive, idle, intractable, and manipulative, right? So, I would like to ask you, don't you think we all are, having at least 2 or 3 of these qualities within us at any given point of time or the other? So can it be then further labeled? Can we be labeled as somebody, as having a mental disorder? So that's where it all boils down to, in terms of, like, when you look at, the idea of why is narcissism considered to be a disorder? Why is being difficult considered to be, or labeled as one of the criteria for determining a hysteria, or, some person having a hysteria, right? So if you look at the Lacanian, idea of, the Lacanian stages, or the psychosexual stages of development, he talks about the symbolic order, right? Now, the symbolic order is where the child enters, the child becomes a speaking subject. Now, when the child becomes a speaking subject, the boy automatically is considered to be closer to the phallus, which is the center of the symbolic order, and the girl becomes farther, away from the phallus, just because of the gender that just because she's a girl, right? So the lack that is there in the woman or the girl is much more than that of the boy, and she has to work 2 times or 3 times towards reaching everybody wants to reach the center of the symbolic order, right? Why? Because that's the, that is the, that is the kind of near perfection. It's a privileged position. That's the subject position that, that's a position that, anybody would like to be closer to, right? And the boy is closer to that position, but the girl is not. That's how Lacanian psychoanalysis looks at the symbolic order. But if you look at the idea of the play, okay, what limits your play is being closer to the symbolic. You are tied to the norms and the rules and regulations that are drawn by the symbolic. What rather does not limit your play and allows you allows you to explore and experiment would be being farther away from the symbolic order, right? So probably the girl who's sitting at the extreme end of this, the last girl on the girl sitting in the last row, right? So she could probably not, she would be the last person that I would probably, if you consider that this is the center, she would probably be the last person that, or even that boy, see, like, I can see him talking or whispering to the next person. They're really not aware of it, but that's totally okay. So that's the point, right? Like, it's you guys are really far from the center. Whereas a girl sitting in the first row or the second row, if she speaks to the, person sitting next, obviously, like it is closer to the, what is the word? It's closer to the center. It's more prominent. You break a norm, we'll know it, right? Whereas the farther you are, you break a norm, we would not probably notice, right? So that's, but then, now, so that's the idea that, even if you're looking at feminist psychoanalysts, I'll get back to these interpretations. So when Shodorov talks about the pre-Oedipal phase, right, the way Freud charts it for, for the boy and the girl, it talks about, or even Lacan for that matter, it talks about the lack, it talks about the inferior position, it talks about the subordinate position, right, of the girl compared to the boy. Whereas what the psychoanalysts, the feminist psychoanalysts want to focus on is the idea that in the pre-Oedipal phase, right, when the girl and the boy are still with the mother, the separation anxiety for the boy is much more than that of, and there is no separation anxiety for the girl. It's an extended attachment, or it's an extended identification and relationality that she establishes with the mother, and there is no lack. That's the idea that, like they are talking about, right? You are, even though you're at the farther end of you're in the margins. Margins are not something or some place to be, looked at in a limited, as a lack, as an inferiority, as a subordinated position. No, it's not, right? So the language further, what the woman, takes up is not the same as the language that is presented in the symbolic, and it is very different. The female language is alienated. It is supposed to be already in submission to the law, but instead, what do you want the female language to be, right? The female language, if it really speaks for itself, it would always be relational, it would be sensory, it would be contextual, it would be symbolic. And this is, this is because the female ego is more flexible, it is more permeable, it is not as rigid and fixed as that for a man, right? So while I look at, so going back to this particular movie now, okay. So the movie goes on in a way where initially you see Shefali Shah being, she's portrayed as one woman who is following the norms that is put down by the patriarchy, right, or the symbolic order. And probably she's also trying to look at what, or are trying to understand and accept the disorder that is there within her, right? So, or that's growing, right? The idea of dementia, the fear of forgetting, the fear of not remembering the people around you, the fear of not. So the last, part of the movie goes at a point where she says, what if I forget my son? right? So there is so much of fear that is there within you. Can you and why is that fear so prominent, right? It makes a difference to the woman when, according to feminist psychoanalysts, when the relationality is not responded to with an equal amount of love, with an equal amount of, acceptance, right? That's the idea that, certain feminist psychoanalysts talk of when they look at, the female ego versus the male ego, when they look at the Oedipal phase, the pre-Oedipal phase for a girl and a boy. Now, in this particular, scene, you do see that, the woman has already met her romantic interest, and the man who's probably, the legally wedded husband is, so there are many others here, right? So there is the woman, there is the husband, and then there is the other romantic interest, right? So if you look at the conformity and the non-conformity and the norms, she's obviously deviating from the norms. She's obviously playing in the margins, right? So there is a lot of rules and regulations that are broken as she meets her romantic interest. But the husband is there, and he does see this play along the margins, right? And he asks, have you ever been this happy with me, right? So you do see the subject asking, the question back, from just going and getting the salt and not asking the husband to go and get the salt. You do see the woman asking the husband back in a very, in a very calm tone, does it upset you that I'm happy when I'm with him, right? And she also talks about, that doesn't mean I was never happy with you. So this is probably the relationality that, I don't know, this is how I would like to interpret it as. So the multiple, relationality that women have versus, the men who have a very stable ego boundary, right? And then she talks about that fluidity and the contextuality as hints at it when you can see that when she says, you are not the same, neither am I, nor is our relationship, right? So for a woman, as the, years go on, with the number of people that we meet, with the, with probably a son, a child being born, with, people that she meets, day in, day out, and the kind of relations that we establish, right? The ego takes in or, absorbs every bit of, your surroundings. And that matters a lot to women, right? So the extended attachment, the relationality, all of these things determine who you are, what you are, and the I that you are, right? So in the context of, the mental health further, so this is where she asks, what if I forget Bharat, right? And even in the in this so in this context, when she asks, what is it that, what if I forget my son, right? You do see that fear in the woman, but never has she thought about what if in the entire course, every time you see a certain relationality that she establishes, right? It is about what if I forget this person? It is about what if I forget this, it's always very, very relational and very, very contextual, right? So, for example, I would like to draw inferences in terms of our everyday living, right? Of course, now, you do see the society changing a lot. Okay, there is a lot of fluidity in terms of the roles and performances that people take up. But even in this fluidity, we do see certain stable egos, ego performances, right? So these, for example, if I have to ask you, now going back to the same idea of, how many of y'all are, okay with the idea of your dad cooking in the kitchen? But how many of y'all do see this happening often? What about your mom cooking in the kitchen? How many of y'all see this, happening? Isn't it our moms cooking in the kitchen most of the times? Yeah. So it's now coming back to the idea of mental health, right? And how many of y'all know what is menopause? What is menopause? Okay, one of y'all can answer probably. Yeah? And what happens with that? Do you know the kind of symptoms that women go through? Biologically, you stop menstruating after, if you've stopped menstruating for 11 consecutive months, that means you've attained menopause. So psychologically, what do you think, what are the changes that happens to women? Okay. Anybody who wants to comment on what happens to, women when they go through menopause? Yeah. Yeah, that's where I was coming to. Now, if we think of, like, say, for example, the examples that I gave you with hysteria, right? A woman being difficult, or anybody being difficult, narcissistic, all of this. Of course, that's a very earlier definition of hysteria. Okay? Now, coming to understanding other mental disorders as well, right? When you talk of depression, when you talk of, like DSM understands depression as, there are criterias and checklists that you need to fill in, right? If you're going through sadness for a certain period of time, for this many months, etc., 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 and these are the other symptoms, it is depression, right? But when it comes to a woman, okay, why am I talking about women? We menstruate every month, right? So when it comes to, having a baby, again, there is a lot of hormonal changes and upheaval that happens in a woman, right? Again, that would be somewhere at our, peak reproductive ages, right? And women can have 1, 2, 3, sometimes more than that children as well. So again, the kind of hormonal upheaval that happens every now and then, right? Okay, come 40s now, there's perimenopausal symptoms that sets in. But do we know why our mothers or our sisters who've just conceived would act a certain way, would suddenly start crying, would suddenly be like, like yelling at us for no reason, right? I think in terms of the kind of awareness that we have with regard to, these kind of emotional symptoms that women go through every now and then, right? Probably people who, there are girls who have PMS, right? I think PMS is something that's not unknown to most of you. I think today, even the guys know about it, right? As to what is it. When it comes to postpartum symptoms post-pregnancy, not many men are aware of it, right? Sometimes we can be really, really insensitive and say, why are you like overreacting over this, right? It is just a tiny thing, or it's just a minor thing, right? We could say the same things to our mothers as well, probably, when they are overreacting over certain things. You never know. It would be a menopausal symptom that goes on for 10 years, So if this goes on for that, so I would talk about, like if this goes on for 10 years and the woman is depressed, right, and shows the symptoms of being sad, do we call the woman as, being having a certain disorder? Or is it a response to the pathology that is, within you, right? It cannot be just, whereas this is not the same case for a man as much as it's for a woman. I'm not generalizing, right? So that is where, and I would end it with that, wherein, there are various culturally sanctioned symptoms, right? As to how, people should act in a certain way, certain time, certain place. But can women be doing that all the time? Considering the pathological changes that are happening within them, can we be doing it and abiding by it every time? So in that case, can we determine a certain mental health condition and label the person with a certain stigma, right? Can we do that? Now that's the next question. right? We easily tell that, oh, she's, she's under, she's, what do you say? Oh, that woman has lost it or something like that. We keep saying that, right? It's very easy to say things. But like, are we trying to look at what is the cause for it? Can she control it, Whereas when it comes to things like hormonal changes, nobody can control it. Nobody, right? So then in that case, so these are the various reasons why, psychologists, feminist psychoanalysts talk about how, every disorder is a reasonable response. And not a it is rather a reaction to a pathology. But the way the society sees it is, it's a response, to, it can't be like, you cannot respond to a certain thing a certain way, and if it is not conforming to the social norms, then it is not a reasonable response, right? You need to be categorized as, or as belonging to a certain, frame of a disorder, right? So that is, I think this would be the point of probably further discussions or, thinking or, understanding for the various disorders in terms of mental health, and the way it could be seen, or the way it requires a social, perspective as well, when you try to label a certain, disorder as, as a certain individual, a woman, as having a certain disorder. Right? So I think that's where I would stop my presentation. Thank you.
Thank you so much, ma'am. We are so thankful to you for taking us to such an informative and enlightening journey, and discussing about the complex nuances and layers within the construction of gender and mental illness. Now, we would like to take up the question and answer session. So the floor is open for Q&A sessions. Any questions from the audience?
Good morning, ma'am. My question is, the world of today has pockets of war across the globe. So, mental health of women in war, has attention been given to them, or are they being marginalized?
Okay. I think this is a very, it's a very broad question to ask, considering the kind of atrocities that are happening around, right? Like I told you, it's, I think here, more than just women, even men are at stake when it comes to, if you're looking at the current atrocities that are happening around the world, I think humanity should be the most, are we looking at men, women, children, and everyone else, right? In terms of their mental health. That's the thing that we need to look at, right? Are they being catered to? Are the basic necessities being given? Or, are we looking at it from a humanitarian point of view or standpoint even before a gyno? I don't know. This would be me as a non-researcher talking as to, can we look at it from a humanitarian standpoint more than, being, if women's mental health is catered to. Of course, nobody's mental health is catered to here. That's the thing that we need to understand, right? End of the day, war is all about, I don't know, it's going to the worst. I don't know, I wouldn't want to comment on this because I do not understand where the world is going to, right? It's all about living and letting live everyone else, and I do not see what, peace organizations also are, working around. So I would not want to comment on this.
Good morning, ma'am. My question is, why has been a rapid increase in the medicalization of our emotions and everyday life? Like if I'm angry, they say it is anger management syndrome. Like if I'm sad, it is depression. If I'm anxious, they say anxiety. And if I'm afraid of something, I have panic attacks. And then if I'm shy, they say social anxiety disorder. Increase of everything is labeled and put on a seal. So why is it happening? And another question is, ma'am, if a man is diagnosed with a mental health disorder, he is being treated with the dignity and respect that he deserves. But if a woman, it is a train wreck. And what is your suggestions to eradicate the stigma around it, ma'am?
Okay, to answer your first question, I wouldn't say answer. You've actually put the crux of my, my talk, right, in a, with realizing a lot of things. At the same time, I'm not saying every minor issue is something that should not be focused on or concentrated on. It could further, blow up blow up later for certain genuine issues, right? But when it comes to labeling and categorizing every tiny thing or tiny issue, to the point of categorizing it, or labeling it with a bigger, or a very serious name. Now, I don't know. So that is where it starts creating an issue, because you do not know where to draw the line after some time, right? And the very idea of labeling and categorizing it, we should understand that if someone is shy, that is the way the person is. The person need not be, speaking in a certain, always speaking to people, or, responding to people in social situations. Now, that's what I talk about, culturally sanctioned, expectations, right? So that's the assigned role that we have, that while I'm in a social situation, I need to be speaking to people in a certain way. At a, so what if I do not speak, right? Will I still be, accepted by the society? Now that pressure, of being accepted by the society is what makes us behave a certain way, certain time, certain place, right? But if you are playing around in the margins and do not really bother about, that doesn't mean that, you can go about doing whatever you want, but, there has to be, now that's a thin line that we are talking of, and even though theory says certain things, we cannot really follow everything to the, to the T. But, in terms of the culturally sanctioned symptoms, the roles and the way we follow it, it's about, trying to balance that line of fluidity, right? And doing what we want, and respecting the other person when that person does what he or she wants, right? And the idea of stigma is also the same thing, and that's exactly where, it started off with hysteria, right? When a woman is being difficult, when a woman starts thinking, rather, I think that's one of the thinkers, I do not remember who, I think it was Showalter who said that it's a female malady, right? And the minute a woman starts to think is when men think that it's not okay, right? And you start categorizing the woman and stigmatizing them, right? Which is not okay, right? So, yeah.
Thank you, ma'am, for patiently answering to all the questions. We have a few more, but because of the time constraint, we are not going to take those. I call upon Mr. VC Prakash, the Assistant Professor, Department of English, to deliver the vote of thanks. Thank you.
Thank you, ma'am. As we draw the curtains on this illuminating session exploring the construction of gender and mental health, I am honored to express our deepest gratitude to our eminent speaker, Dr. Deepali Malya. Dr. Deepali Malya, your presentation has been a symbol of hope, guiding us through the intricate landscapes of societal constructs and mental well-being, ma'am. And you have narrated trajectory of mental illness and movie well, and you have brought up the psyche of the people and interpretation of the characters of the movie. And on behalf of everyone present here, I extend my heartfelt thanks to you, ma'am. In the words of Maya Angelou, I quote, "Do the best you can until you know better. Then when you know better, do better," unquote. Ladies and gentlemen, as we bring this enlightening session to a close, I have the privilege of inviting the coordinator of UG Department of English, Professor Jarin Jose, to join me in presenting a token of appreciation with certificate to our esteemed speaker. Thank you, sir. Before we proceed, I must express my sincere thanks to Father Joshi Matthew for his unwavering encouragement and execution of this event. I would also like to extend my gratitude to our dedicated UG coordinator, Professor Jerin Jose, and PG coordinator, Dr. Loyola Thomas, for their constant support and invaluable guidance. A special note of appreciation goes to the organizing committee members who have worked behind the scenes to ensure the execution of this event. Your commitment has truly made a difference, the team. And the last, but certainly not the least, my heartfelt thanks to all the participants, my dear colleagues, for your active participation. It is your enthusiasm that has been made this gathering intellectually stimulating and rewarding. Now I request all of you to stand at your place for the photo. Thank you, one and all.
Dear students, all the English honors and MA students can remain here, others can leave. So next we have paper presentation. We'll let you know the venues in just a couple of minutes. Participants also can remain here for 5 minutes. We'll give you the details about the venue. Dear students, MA students, we can be here in this venue for the paper presentation. And BA, 4th semester and 6th semester students can go to the second floor A1. And BA first year students can go to PG block conference hall 1. PG block first floor conference hall 1. And students, you can be in the different venues, whatever is allotted by 11:20. Dear participants, we have 3 venues, and in the WhatsApp group it is mentioned about the venues, means for each one where you are supposed to go it is mentioned. So this is A2. Those who are present here, you can remain here. And the next venue is A1, that is the second, this is third floor. So we have one more auditorium in the second floor, that is A2. We can go there, those who are presenting there. And there is one more venue which is P2 conference hall PG block, so that we can find see the PG block, MBA block we can find in that MBA block, first floor we can find P2. Volunteers will be there to help you out if means we can go with them. And you can also be there in the venue by 11:20.
Battery.